Thank you, Okusa. That's right. I will be looking at the cost of the healthcare system. That is, while President Uhuru Kenyatta celebrated the gains made as far as the healthcare system is concerned in the face of the COVID-19 pandemic, what has been the cost of not already having those systems in place when the COVID-19 virus struck? When President Uhuru Kenyatta took to the podium at the National COVID-19 conference on Monday to reflect on Kenya's response to the pandemic 6 months in, he boasted of improvements made to the healthcare system.
In fact, in this period of 6 months, we have actually installed more medical equipment than has ever happened since our country's independence.
The question is why it needed a pandemic to spur said investment into the country's healthcare systems. But even as he took cognizance of the strides he felt his government had made, healthcare workers at the region's largest referral hospital, Kenyatta National Hospital, were downing their tools, as others in Makueni threatened to do the same. This as the national and county governments voice commitment to universal health care.
Ideally, when you have a health crisis, it needs to be dependent or founded on an existing resilient health system. And when you look at a resilient health system is basically universal health coverage. A resilient health system is what provides you a backup or shock absorber for increased demand on the health system.
And by the government's own admission,
so fellow Kenyans, our expanded health infrastructure, as I've just mentioned, is indeed impressive. Is it sufficient a buffer to keep a second wave at bay? The answer to this question is a resounding no.
As her neighbors shored up their community healthcare systems, Kenya focused on the flashier and now scandalous Managed Medical Equipment Services project.
We need to look at a good mix and compensation and capacitation of health workers. We need to look at service delivery near where people live, not secondary and tertiary care, not building cancer centers.
We have over 300 ICU beds and 7,411 isolation beds nationally. And this done in 6 months. These achievements are indeed phenomenal.
While commendable, Gitahi cautions against underestimating the primary health facilities.
If you have a weak primary healthcare system that is not accessible to all, it's not equitable, therefore the poor can't access it, and it's also not properly financed and properly governed, it means that people then fear to come into the system and therefore they die at home or they stay at home.
Fortunately, mobility restrictions and age demographics have reduced Kenya's COVID-19 risk factors, including from the underlying conditions triple threat, high blood pressure, diabetes and obesity. But for all the interventions the government may make, a lack of trust in the integrity of its institutions may undermine all its efforts.
This is so critical even for response, because if a government is not trusted, then its strategies are not obeyed.
Well, it all boils down to money, doesn't it? And Julian, perhaps you could tell us how well the economy is withstanding the COVID-19 pressure.